Hello, this is Dr. Grande. Today's question is, what is severe and persistent mental illness? We can think about this term, severe and persistent mental illness, as being distinct from the term mental illness, in the sense that with severe and persistent mental illness, we expect a more severe impact on functioning. We expect the condition to be chronic, that is, to be long-lasting, and we'd expect to see a limitation in one or more major life activities. So the term mental illness is broad, and the term severe and persistent mental illness is a subcategory of mental illness. So there's a smaller number of individuals affected by severe and persistent mental illness than we would see affected by mental illness. Sometimes we hear this referred to as serious mental illness, and there is no single definition for severe and persistent mental illness, but generally we think of this as having a few different elements to it. The first would be, in most cases, for somebody to have severe and persistent mental illness, they would have to be 18 years or older. And within the last year, or currently, they'd have to have a DSM diagnosis. That's a mental health diagnosis from the Diagnostic and Statistical Manual. Now, there are different definitions in terms of which diagnoses are eligible as part of this definition. For example, in most definitions, substance use disorders are excluded, as are developmental disorders, dementia, and any mental health disorder due to a general medical condition. Now, with some of the definitions we see of severe and persistent mental illness, individuals who are under 18 could qualify for this category as well. We also see certain mental health disorders overrepresented as part of those who are categorized as severely and persistently mentally ill. For example, schizophrenia and schizoaffective disorders are overrepresented. Psychotic disorders are as well. Also, unipolar depression and bipolar depression, so major depressive disorder and bipolar I disorder and bipolar II disorder. We also see other mental health disorders as well: borderline personality disorder, eating disorders, post-traumatic stress disorder, and a variety of anxiety disorders. Now, the prevalence for a mental health disorder in general in the United States is somewhere between 20% and 25% in any given year. So 20 to 25% of Americans will experience a mental health disorder in a given year. For severe and persistent mental illness, that percentage drops to around 4%. About 4% of adults fit into this category, severe and persistently mentally ill. And remember, most of the definitions require an individual to be an adult, so the prevalence is only related to adults. Severe and persistent mental illness affects females more than males. The prevalence for female adults would be 5% and male adults 3%. One of the most surprising statistics we hear about severe and persistent mental illness has to do with the life expectancy of individuals who have it. The life expectancy for any given individual in the United States is 77 years. The life expectancy for somebody with severe and persistent mental illness averages 52 years, a 25-year difference. Now, those 25 years represent what we call excess mortality, and 30% of that excess mortality can be explained by suicide. But the rest of it, there are other causes to explain it. Many of the causes of excess mortality we consider to be modifiable, meaning policy changes, availability and effectiveness of mental health care, and other changes can lead to a reduction in this mortality. So some of these modifiable factors include substance use. A number of people with severe and persistent mental illness also have a comorbid substance use disorder. Somebody with severe and persistent mental illness is 3 to 5 times more likely to have a substance use disorder. Other factors include lack of exercise, poor nutrition, and increased rate of obesity. Somebody who is severely and persistently mentally ill is 50% more likely to be obese. We also see risk factors like poverty, homelessness, unemployment, increased levels of trauma and victimization, unsafe sexual practices, and lack of access to medical and mental health care. I mentioned that a number of mental health disorders can be associated with severe and persistent mental illness. However, there are particular risk factors that aren't necessarily specific to any one mental health disorder that we see in terms of affecting mortality. So these risk factors are associated with higher mortality. These include disorganized thinking, reality testing, paranoia, impulsivity, and difficulty communicating. The treatment of severe and persistent mental illness can certainly be a challenge. However, research shows that treatment can greatly improve the quality of life of individuals who have severe and persistent mental illness. I hope you found this description of severe and persistent mental illness to be interesting. Thanks for watching.